Dr. Mehmet Oz joins us today, the administrator for the Centers for Medicaid and Medicare Services, and I appreciate you being with us today. It is Medicare Open Enrollment right now. What do people need to know? Are premiums going up? There are different plans. There's a lot.
Barbara, lots happening, but I can demystify it for you. We've upgraded the system. A lot of folks have worked hard to improve the experience. If you go to Medicare.gov, it'll give you tons of information about open enrollment. Now, the purpose of open enrollment is to give you once a year a chance to get a fresh look at your program, because insurance companies change, you change. The opportunities that are out there are quite great financially. You're talking about hundreds, maybe thousands of dollars of savings if you do it the right way. And so we built into the system of Medicare.gov some ways of you figuring out exactly how you can compare the insurance company that you're working with now to other companies. Again, there's no pressure. We have no salespeople. You own us. We're the government's crown jewel of social safety net systems. And Medicare, which I just joined this year, Barbara, so I'm a beneficiary as well, works brilliantly. But you got to make sure that you show up for it by going to Medicare.gov and ensuring that you're on the right system.
A lot of people are concerned about the government shutdown right now. Is that going to impact open enrollment?
Government's not going to affect open enrollment in any way. The shutdown is about a bunch of political battles that don't affect Medicare. Medicare, interestingly, is one of the few things that Republicans and Democrats both adore. So no one's touching it. No one's hindering it. It's getting paid for. And the one thing is, we in the government want you to come check in to make sure you're getting the best value for your money. And you got to do it by December the 7th. Otherwise, we'll just keep you on last year's program in most cases, which may not be best for you. But I'll give you an example. If you go to Medicare.gov and you're on a medication, you may find that it's a couple $100 cheaper on another insurance company than the one you're on right now. Well, you can figure that out pretty quickly right now, and maybe you'll switch. Or you might find out that your doctor is no longer in one insurance company, but they do take another insurance company. So make sure you pick the one where your doctor's practicing. Or you may have a new condition that might benefit from being with the Medicare Advantage plan. So you want to make sure their supplemental benefits cover it. These are all the kinds of things we'll walk you through. And you know what? If you don't like websites, Barbara, just call 1-800-MEDICARE. We got a real live person there who will talk you through it.
And what I'm hearing is with Medicare Part B, as in boy, that premium is going up, but nothing announced yet. So how can people sit down and sign up for that right now?
Well, Medicare Part B might be going up. That's the part that pays for drugs that your doctor is giving you often in their office. But Medicare Part D, which is the benefit where you go to the drugstore, that's actually going down a little bit. And the Medicare Advantage prices in general are dropping. So there's some up, there's some down. In general, we've fought hard for you to try to keep the prices stable. I think we've achieved that goal. But you'll not be getting the most benefit for this if you don't pick the right plan. If you pick a plan that charges you $500 for your medications every month, when there was another one that would have done it for near nothing, you're wasting money, your money. And we want to make sure you don't do that.
How's it going to impact us that there are fewer insurers offering the Medicare Advantage plans?
Doesn't make much of a difference, especially in Rhode Island. You have so many Medicare Advantage plans that are already there. You want to have a marketplace, Barbara, where some companies leave, some come in. That means you've got a healthy system. If everyone left at once, that will be a problem. That's not happening. And you always have regular Medicare, which is the old-fashioned one that was created 60 years ago. About half the people are on that as well. So you're pretty well balanced. And in many parts of the country, you're going to be pleasantly surprised that the bills are not increasing as much as many would have feared.
What are some of the changes we can that we will see come in this coming year for 2026?
Well, the most favored nation drug pricing, which you've been reading about every week for the last month, we've been in the White House, in the Oval Office with the president announcing that we're pushing drug companies to do what should have happened years ago. I think most Americans, I'm hoping, know this, but when you buy a drug in America, a brand drug, the pricing is usually 3 times higher on average than that same exact drug made in the same factory in Europe. So why is that? Why is it so much cheaper over there? It's because our leadership wasn't paying attention to it. So we've driven those prices down one by one. These different companies are coming into the fold. They're allowing, making commitments to charge the same prices here as they charge overseas. And that's a healthy thing for the health of the American people, because 1 in 3 people, when they go to the drugstore, can't afford their medications, so they don't take them. And I want to stop that.
People who are already on Medicare, if they don't want any changes, they just let it ride?
They can let it ride. You should really go to Medicare.gov though, just to make sure. You'll be surprised. Sometimes these policies change without you knowing it, and you will have a worse experience next year. So even if you're happy, just take a quick look. All you've got to do is go to Medicare.gov, sign in, and take advantage of all the easy to navigate systems that already exist. And you should be able to, within a few minutes, make sure that your current system is the right one for you.
Do we still have the Medicare programs, or will we have in 26 the ones that help pay for utilities and groceries?
There are Medicare Advantage programs that are allowed to use supplemental funding. So the money they save by taking care of you and managing you, they can give you back in the form of supplemental benefits. And there's many different rules on those, and they change from area of the country to area of the country. But at a high level, they're still able to do what they have historically done, which is to provide you additional support for conditions you're worried about. Things like traveling to a doctor's office, or getting food pricing, or food that's maybe you couldn't afford otherwise, signing up for a gym so you can get exercise, the kinds of things that people care a lot about.
And most people right now, or many of them, are paying $185 a month. We're looking in the crystal ball, nothing set in stone. What are you thinking? $20 more a month?
It's hard to tell, and if I knew, I couldn't tell you, because until this becomes public, it goes through a rules process where obviously everyone wants to know the answer, but they're not allowed to. We need to let our teams finish their assessment, and a lot of people have offered comments on these prices, which we also try to incorporate into our final decision.
What is your bottom line message to, let's say, newbies who are just now signing up? I know you are a new recipient of Medicare benefits, but what is your bottom line message to newbies who are getting ready to sign up?
The newbies, you got a lot of flexibility. It's easier for you to sign up because you don't have such a curtailed period. But open enrollment is an empowering opportunity for people to take this crown jewel of our healthcare system, safety net system, and use it effectively to help you. So Medicare.gov, it's yours. Use it, please. No salespeople, no pressure, but you got to do it by December the 7th.
And I do want to ask you just about something that your boss, Health and Human Services Secretary Robert F. Kennedy, came out with Jr., and essentially the president afterwards, about the connection between Tylenol or acetaminophen and autism. What are your thoughts on that?
Well, our administration, the president leads by example. He wants people to know he's thinking, and as soon as data comes in that he's concerned about, he shares it. And historically, that's not what would happen. The government would find something out that was concerning. We just wouldn't tell you until we were 100% sure it was right. And there's folks who will advocate for that. But it's going to take us at least 5 more years to know the answers to the real questions around acetaminophen. The brand name Tylenol is how many people know it. But that's, I don't think, the right thing for the American people. I think you should know about what we know when we know it. So a paper came out actually from Harvard about a month ago, and the president wanted to talk about it. So we highlighted the fact that for women who are pregnant, they might want to reconsider taking Tylenol for minor issues. Obviously, if you've got a higher fever or significant pain, talk to your doctor and take this medication. That is one of the few options that's out there. Acetaminophen has been used in that setting for many years. But if you've got a mild fever, tiny ache and pain, maybe you want to recognize that there's nothing that's we know for sure to be 100% safe when you're pregnant. So less is more.
To my knowledge, there's nothing that has shown a definitive cause, though, between acetaminophen and autism.
We don't have a causation, but we do have an association that's concerning. And I'll tell you the question, Barbara, I always ask the investigators, if it was your wife who was pregnant, what would you tell them? Because that's what I'd like to tell the American people. I had that same rule of thumb on my show. When we don't know the answer, and often we don't, what's the best advice you'd give family? And my advice would be, if you have a low-grade temperature, 99.5 degree temperature, and you're not sure what it's from, you're not that worried about it, I wouldn't pop a couple of acetaminophen with the off chance that it might reduce your fever, because I don't think that fever is that concerning, and we don't know 100% sure. The company itself says they don't know for sure because we've never done those trials. But what you do know, if you've got a high temperature, and we know other medications aren't safe to take when you're pregnant, then you ought to talk to your doctor. In that setting, it makes perfect sense.
And to my knowledge, acetaminophen is the one that is preferred, or maybe the only one that pregnant women can take if they do have a high fever.
It's the only medication that has been recommended for a high fever. That's why doctors recommend it, and 100% respectful of that.
Okay. I appreciate your time today, Dr. Oz. Thank you so much.
Take care, Barbara. Stay well.